Hi, everyone. First and foremost, I'm going to ask you to like and subscribe to get the message out to more people, and that would be great, and I would appreciate that. Thank you very much. Okay, next, I'm going to say a thank you to the people who have been donating. I just wanted to share with you some of the donations that I got in. These are tuna salad packets, and these are wonderful to hand out. Okay, these are rockin'. And I know you've seen me before talk about like the salmon, tuna. They're all amazing. These little packets are just awesome. And I was really touched by the note that came in. And the note that came in with it was nobody should have to spend a night hungry. And that is the truth. It is the truth. And thank you, King Danger. And also, thank you for the Advil. And I agree that emotional pain should be cured as easily. And we will get these out. This is awesome. This is actually very, very hard to come by. Um, yeah, any kind of Tylenol, Advil, any of that is actually pretty hard to come by out there. So these are amazing. Thank you so very much. And I will make sure that they get out. So awesome, awesome. We got some tuna salad and we got some milk bone dog biscuits. What? Yay! Look at that. So we are, and then there were some monetary donations that came in too. So we're going to get out there to the people and get them some things that they need and just really get out there and let them know that they matter and that there are people who care. So that's really awesome. So, moving on to what this subject is about, we're going to be talking about assertive community treatment. Now, what I'm going to talk about what assertive community treatment is, and the way I'm going to talk about this is at first what what the characteristics of it is, and it focuses on people who need the most help, and usually that means those who have severe psychiatric illnesses, and there's also a offshoot to assertive community treatment that deals with those who have severe substance abuse disorders. Now, if we go down that and we focus on just the characteristics of assertive community treatment and we look at it and we put the focus on if we use these characteristics and focus that on the displaced, it fits perfectly. Now, we have these programs instated, and we know that the displaced and homeless are a vulnerable population, an extremely vulnerable population. The mission of the Assertive Community Treatment Program is to promote independence, rehab, and recovery. Now, it's to prevent homelessness, unnecessary hospitalizations, and negative outcomes. So the whole point of this program is to do that. And this is an evidence-based program. Now, I know King County has the program for assertive community treatment, and there's only 270 spaces. And what I don't understand is more money was given and they formed a new committee. And here's what's very frustrating is when you see things like this that actually will work if the proper tools are given, such as housing, because you can't prevent homelessness unless you provide the housing, and health care, because another characteristic of assertive community treatment is focusing on in-home, in-community treatments, in community integration. And what this does is it makes it so that there's not the institutionalization and having to go from on the street to institutionalization to in-home. It cuts out that middle step and it provides a better way to integrate with the community in a healthier manner. It takes a whole team approach. This is social workers. This is primary care physicians. This is getting a person to the specialists that they need, because we know for a fact that when a person is displaced or homeless, their mortality or the death rate increases by 15 to 20 years. So we know that this is serious. This is costing people their lives. This is an emergency. This is a crisis. So we have to treat it as such. Another factor of the assertive community treatment is that the team takes responsibility and accountability for that person, which means they keep track of that person. In people who have had problems with chronic homelessness, severe psychiatric issues, substance abuse issues, disabilities, a lot of times executive functioning can become overwhelming. And having a social worker or team be accountable for the work they're doing and accountable for the things that they say they are going to do for the patient or the person is key. There is a conscious effort in assertive community treatment to help avoid crises. In other words, crisis management, different therapies, evidence-based therapies, there's keeping track of the person to make sure that they're going to appointments, positive based, things. The time to work with these people it's not based on a certain time limit. It's an unlimited time frame. So it isn't like they have 60 days. They have an unlimited time to work with this person to get them healthy. This is how it should be. There is not, when people become healthy and they integrate into a community, the community as a whole becomes healthier. And when we have these programs that are instated, but we don't give them the foundation to function properly, we do ourselves a disservice. So right now, I'm just explaining the basics of what assertive community treatment is. And to my viewer that's going to bed, good night, and I hope you have a wonderful morning in the morning. I wanted to explain what assertive community treatment is and just put out there that, we understand, hopefully as a society, that we have a humanitarian crisis on our hands, that homelessness and displacement is a healthcare crisis, and loss of habitation is a healthcare issue. So in that, it's going to take a whole team, whole healthcare approach. And in the assertive community treatment program, there is that. Now, there's many, many other facets to the things that need to be done as far as immediate outreach and teaching people to have a good quality of life where they are until, we get them to the places that they need to be. But for right now, this is the subject for tonight. I hope you all have a wonderful, wonderful weekend, and hello, and thank you so much for all your support, and my heart goes out to you. So much love. Have a wonderful evening. Bye. Oh, and please like and subscribe. Thank you. Bye.